Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and today we have a very important guest. You're going to want to hear what Dr. Ling has to say. He is starting this year. He has Practice on Fire, and he's started this in the past. If you haven't heard of Practice on Fire yet, it's very, very useful, but don't let me talk it up. Let's hear from Dr. Ling. How are you?
Great, Justin. How are you today?
I'm doing great. I'm doing great. It's an honor to have you on, and I'd love to hear more about Practice on Fire. I've heard nothing but good things about it. Heard there's an all-star speaker lineup. But before we get into the details, I was hoping you could kind of tell me about the history of how Practice Fire came to be and why you started it.
Well, Practice on Fire was actually started by Dr. Graham Dursley, and it originally started as a mastermind group. And his thinking was that it would be great to get together a group of like-minded dentists, and he chose to bring members in who are entrepreneurial type dentists. And the idea was to get together online and have a free and safe area to talk about stuff that we are comfortable talking about with our peers that we know, and it's not completely anonymous. And it turned out really great. We shared a lot of amazing things. We've really helped each other, and it really just shows the power of surrounding yourself with people who have similar mindsets as you, or surrounding yourself with people who maybe have accomplished the things that you're trying to accomplish. And out of that grew the live events, where Graham and I thought that this is so much fun to do virtually or online. How much fun would it be to do in person? And that's how the live events took place. The first one was last year in San Antonio. It was amazing. We had great feedback from everybody that was there, even though we had a lineup of pretty much rookie speakers, people who have never done this before, but people that shared a lot of passion for what they were doing. I think they did very, very well. So we're going for round 2 in May this year.
Wow. I mean, I would have never guessed. I hear so much buzz surrounding this. I would have never guessed this was just kind of amateur speakers, because what I heard was the value that was offered at Practice on Fire last year was unparalleled.
Yeah, I mean, well, we hope to bring speakers that are really passionate about what they're talking about and have a lot of experience and success in what they're talking about. And I think that even if you're an amateur rookie speaker, if you're talking about something that you know a lot about and that you really love talking about, that makes it a lot easier. And I think that authenticity really comes out in our speakers.
Let's see, just off the cuff, you know, I'm thinking you got at least last year you had Andrew Turchin. I think this year you've got Stefan Kuzmak,
yeah,
Gina Dorfman, Dr. Christopher Phelps. Who am I missing?
You know, most of the guys are names that you probably wouldn't recognize. They're guys that are just regular dentists. They're not superstars in their world, but they found little areas of success. They found some little secret that's working really well for them, and that's what they're going to share. The names that you would recognize are the ones that you mentioned. Guys like Corey Glenn, he's going to be there. He's our native Tennessee host that's going to be showing us around Nashville and showing us a good time as well. But he is, at least to me, one of my mentors, a real hero in the clinical world for the things that he's doing. And right now, I don't think people realize the things that he's working on. He's going to change the world and how we approach guided implant surgery for implants. And he's really lowering the barrier to entry for doctors to do it. He's going to make it so much more accessible. Right now, I think we as dentists understand the value in guided surgery, but there's so many barriers to getting in the game, and Corey's just destroying those barriers. He's going to make it so easy to get in the game and really provide amazing service for patients. So he's a big name. Chris Phelps is another one that is definitely underrated. He's not super well known. Mostly because he's he's quite a modest guy. He doesn't like to brag or talk about himself. He likes, I guess, other people to promote him. But he's another guy that's changing the game and is talking about things that are just mind-blowing, so simple but so effective in terms of how we communicate with patients and how we market to patients. So he's another guy that in a few years he's going to blow up and be a massive name in the dental world.
Oh, I believe it. I believe it. You know, he was on the show and we had a nice conversation about uh, walking down the price stairs and some of the persuasion techniques that he's used about case presentation and what really happens in the mind of a dental patient, which I think a lot of dentists don't really think about when they're presenting a case. They think about clinically, this is what you need to do. And would you say practice on fire? So you got a nice combination of clinical stuff, you know, and then maybe more the business or marketing side. Would you say it's more oriented towards marketing business, or would you say it's more oriented towards clinical?
Well, before I get to that, Josh, I just want to respond to the stuff about Chris Phelps. And I know that one of the hot topics on Dental Town these days is the ethics of using things like persuasion and influence in the medical profession. And I think the people that are responding in the negative just haven't heard Chris speak. And I think once you hear him speak, he's the most stand-up guy. I mean, I'd let him work on my teeth any day of the week. I'd send my kids to his office any day of the week. He's very, very ethical, and he teaches not just how to influence patients, but also the why behind it and when it's ethical to do it and when it's not ethical to do it. So I think for anybody that's maybe a little bit turned off by phrases like influence or persuasion or consider them salesy, you really just got to give him a shot. Listen to one of the lectures, maybe the clips that we videotaped of him, and you'll see that it's just like anything. Use your powers for good or use them for evil. And there's definitely ways that we can use them to better our patients. Now, to get to your question about is it clinical or is it non-clinical, I don't really see it as clinical versus non-clinical. I see it as having a single goal, which is practice growth. And we're going to talk about practice growth from stuff you do chairside. For example, talking about doing digital implants with Corey Glenn. And that's something that is technically clinical, but really the purpose behind it is to be able to help our patients better and help to grow our practices. And then there's the obvious practice growth aspects, like how do you market, how do you present cases, how do we lead our teams as well. So it's a good mix of chairside stuff, non-chairside stuff, all of it really focused, though, on how to grow your practice.
Yeah, you know, it's funny you mentioned that there's some negative about the whole influence thing. I mean, here's the way I see it. I wasn't even aware of any negative side of things. Maybe I'm just not paying attention. But, you know, I told Dr. Phelps, I said, listen, you can be the best clinician in the world, but if you can't convince anyone to accept treatment, doesn't matter. Your skills mean nothing. So,
That's right.
I mean, he's really, I think he's changing dentists' lives. If people would just open their minds up, like you said, just go on the Practice on Fire website. You can see him talking about walking down the price stairs, and it makes perfect sense because, you know, you present the $8,000 case and then you bring it down to the $2,000 case. Well, the person's budget doesn't change, but the person feels like you're understanding where they're coming from when you present it a certain way. So I'm really on board with that. That's a really, I mean, I'll endorse it. I think it's great what Dr. Phelps is doing. So yeah, go ahead.
Well, I was just going to say, Justin, that you know, you may listen to Dr. Phelps' lecture for 2 hours, and maybe some of the stuff you find is super helpful for you. Some of the stuff you find is maybe you're not comfortable with, but that's the great thing, is that there is no one way to do it. And we're not saying that you should do it all this way, you should do it all that way. This is what Dr. Phelps has found to be successful. This is what other people have found to be successful. Maybe it can help you too. And even if you don't follow to the letter everything he says, I guarantee you'll learn something from him and from the whole conference.
Excellent. Excellent. Well, it's not just about Christopher Phelps. Let's talk about. I mean, who else? Who else? Maybe that I didn't mention is talking, and maybe we could talk a little bit about Graham, because apparently he gave some massive, massive value. Could you tell me the topic that he spoke on?
Well, last time Graham talked about implants. He's a prosthodontist by education. He talked about implants from the point of view of not this is how you place implants, but this is how you get more implant patients into your practice.
Mm.
This time he's going to be talking about lean principles, and these are things that he's learned from other industries, things like the Toyota principles in terms of manufacturing, and how can we apply these manufacturing principles to dentistry. And it's not about becoming an assembly line or a factory impersonal. It's about finding inefficiencies and finding repeated steps, finding rate limiting steps, and trying to do things as comfortably and as efficiently as possible in our office. So I'm really excited to hear that. That's something that not a lot of guys out there are talking about, and it's another one of those areas where, you know, you hear Toyota and you think, oh, I don't want to be like a car manufacturer. But really what we're doing is so similar to manufacturing. There's a certain number of steps involved. They almost always go in the same order. They're very, very predictable. So why can't we look at these steps and see if we can reorder them or make each one of them just a little bit more efficient to make the whole process more efficient?
Right, right. And, you know, for those dentists out there, if you're spending money on marketing, you know, there's a lot of dentists, they're spending 2,000-3,000 a month or more on marketing. But what I found is I do SEO for dentists, and what I found is, you know, that's really only one piece of the puzzle. So we could get you ranked, we could get you slammed with traffic, we could even, if you have a good website, we can even get your phone ringing. But man, I mean, if the way you answer the phone and the way, all the way down to the last steps clinically isn't all, like you said, it's why wouldn't you want to learn from top corporations? Because look, corporate dentistry, I mean, they've got it down, right? I mean, they've got systems in place. You know, that's how the corporate machine comes in and defeats the little guys, is the little guys just aren't willing to adapt. They aren't willing to learn, right?
Right.
Would you say that's true in dentistry?
It's not about becoming an assembly line. It's about learning bits and pieces and stealing ideas that have worked for this organization, and how can we apply them to our organization while maintaining our own values and our own culture. The other person I'm really excited about that is not a big name and is not well known is Dr. Nathan Geel from Manitoba. And he's a multiple practice owner, and what he's working on now is studying the follow-up process. And we all know that when we talk to patients about treatment, we rarely get a yes on day one. In fact, most of the treatment that I do is from patients that have been talked to about this treatment, their last recall visit, or even several years ago, and now they're ready. So he's studying this follow-up process and what's the most effective way to talk to patients after they've left the office and they haven't said yes and given you the credit card on day one. And how do we follow up them? What do we say? What's the best interval for that? And are there ways to use software and automation to make it even more effective and efficient to do that as well? So he's got some really innovative things he's working on. And I think that's another game changer where right now it's very manual follow-up. Somebody comes in for a consult, they leave, we might call them, send them a letter. We just hope they call and say, yes, can I please have my root canal now? And it just doesn't happen very often.
Yeah, that's for sure. Yeah, people's minds are not on dentistry. You know, and like I said in an earlier episode with Anissa Holmes, you know, prospective dental patients don't think of themselves as prospective dental patients. They're human beings, you know, and we all want to be treated a certain way. You know, we want the way that people accept treatment is doing things like you're talking about, like what Dr. Phelps is talking about. And man, this just sounds like a really, really great opportunity for dentists to kind of, I mean, the matches are there. The matches are there. If you want to light your practice on fire, where do we go, and time and website and all that. How do we find out more, Dr. Ling?
You go to practiceonfirelive.com. That's the website with all the information, the full speaker lineup. Everything's on there, and you can register there.
Excellent. Man, this is a huge event, guys. And well, what is the capacity? I mean, I get the impression that it's I mean, there's just a huge amount of value, but I don't know, like how many dentists do you expect to be in attendance?
We're trying to keep it relatively small. We're certainly not going for 500,000 attendees. I know what we learned from our last event, and a lot of the feedback was that some of the best experiences happened between lectures or on breaks or in the evenings, where we could just get together very casually in small groups and just chat informally about stuff, and doing a lot of networking, making some great friends. We want to keep that environment where it's a tight-knit group of guys who are super excited to be there, people that are like-minded, and encourage that social aspect of the break time networking. And we've built in some features this year, including a Friday night social where whoever's interested can buy a ticket. We'll all go out for dinner and drinks and just chat about our practices, chat about our families, our lives, and a great opportunity to network and meet people with similar mindsets.
That's excellent, man. That's awesome. So, all right. So practiceonfirelive.com. That's where you go to find out more information. I've seen the video. It's you got to see this video, the testimonial video, and then make a decision. If you're like, oh, I'm not sure, watch this video, then make a decision. Dr. Ling, thanks for joining me. It's been a huge honor, and I hope you find great success with Practice on Fire.
All right. Thanks a lot, Justin.
Excellent. Thanks, guys. And if you have any questions, feel free to reach out. If you see this on YouTube, on Dental Town, social media, wherever you see this, feel free to reach out with questions for Dr. Ling or for myself. I'm the Dental Marketing Guy. Thanks for watching the Dental Marketing Guy Show.